And you may have heard Hazari mention that the discussion will focus on the Caribbean Digital Transformation Projects, Health Management and Information Systems. Very important when you consider where we are going in reference to health. Not just health, but today we want to focus on health management and information systems. It's a project that really aims to increase access to digital services, technologies, skills by governments and things like that, businesses as well, and individuals in the participating OECS countries. So Dominica, of course, is one of these countries that has done a lot already. So we are falling in line nicely. So the aim essentially is to fully digitalize medical services in Dominica. And we'll tell you why that is happening, how long it started, what is happening, how important it is, why we should embrace this. There's a lot that should come out from the discussion this morning on Talking Points. So let me welcome you to Talking Points this morning. And of course, we have guests in studio, so I'll go over to them shortly. We're still awaiting the arrival of another guest on the program, but we'll ensure that it happens. So let me welcome you to Talking Point this morning, and we are going to start off the discussion here on DBS Radio. Of course, we are on radio and on social media as well, so we welcome this. And we have two lovely ladies already in the studio. We are waiting Mr. Robert Tong to come as well and give us more information. It's important, of course, that we know these things. It's maybe not a sexy topic. It's not an exciting topic, that people will look forward to. But let me tell you, it is very, very important. And so, yes, while it may not be a hot topic like social trends or current events, like who is likely to make it through to the Calypso semifinals come Saturday, it should be a national conversation when you understand its objective. So let me again welcome you to Talking Point this morning. And with me in the studio is Jennifer Joseph James. She is the Health Management and Information Systems Technical Officer. We also have Janice Pascal, a radiologist at the Dominica China Friendship Hospital. And we are expecting the director of the digital economy, Robert Tong. In fact, as soon as I mentioned this, he has just made his entrance here. So now we have all three guests. And I called out the ladies first, but Robert Tong, you two have a very, you have a top position, in the scheme of things as well. But it's always nice to bring out the ladies first. So let me go to Studio 2 and welcome our guests. Good morning, ladies. Let me start with you.
Good morning.
And just give us your name and just introduce yourselves, basically. Let me start with the, yes.
Okay, so my name is Janice Pascal Ferrer Iglesias, and I am a radiographer by profession, currently the coordinator of imaging services at the Diagnostic Imaging Department, what we know as the radiology, or as Dominicans like to say, the X-ray department.
Yes,
I am the coordinator of that department currently, and I am also the deputy chair of the HMIS task force.
Okay, welcome. And next.
Good morning. My name is Jennifer Joseph James. I am the technical officer on the Health Management Information Systems project, and I am with the Caribbean Digital Transformation Project Information Unit. And it is a pleasure to be here while I serve my country well.
It's a pleasure to have you as well. I expect to learn a lot. Mr. Robert Tong, good morning.
Good morning.
Busy morning for you?
Yes,
already?
Busy morning. Unfortunately, I was not using the digital part in terms of banking, so I had to go in the hall, and that takes a lot of time. I wish I didn't have to do that particular transaction, but that's what we're here to discuss as to how we can do things easier, better, more efficiently, and to be more secure. So my name is Robert Tong. I'm the coordinator for the digital economy in the Ministry of Public Works, and it's a pleasure to be here, and we look forward to explaining to our fellow citizens, especially the persons who are going to be using the system, as to how this is going to make their lives a lot easier and more efficient.
I like this. How we are going to make things easier. How we are going to limit the amount of time, that we spend, just doing simple things which can be digitalized and, become more accessible for us. So we want to look at that. Let us put this topic, though, in proper context. What really necessitated the push for such a project? How did this come about? I'm not sure we want to start off with this.
What I would say is that the government of Dominica has realized that as part of its strategy in terms of moving the country forward and also the people forward, and at the same time being more resilient. We always talk about resiliency. You want to ensure that when you need certain services, you don't have to depend on the people process, which normally takes a long time. People can get lost, and that leads to a lot of frustration. So after the hurricane, Maria, the government realized that, hey, we need to change things, and there came about the whole issue of creating a whole digital strategy. And the idea is to ensure that you can bounce back quicker after such catastrophic events, and at the same time to make things a lot easier. So right now you can pay your telephone bill, your light bill, all of these things online without even having to leave your home. Many of the government services before that you would have to walk to the treasury and pay, then go to treasury to pay, then go to the registry to get your birth certificate. You can now do all of these things electronically. You can fill out the forms electronically, you can pay for it electronically, so you can well imagine the amount of time and money and effort that it saves. Now the same thing applies to the health. Eventually, and unfortunately, we may fall sick, or a family member of ours can fall sick. And what we want is that when we reach to the health center, when we reach to the hospital, when we reach to the doctor, that our information is easily accessible by the respective persons, obviously, and that you can receive service a lot quicker. Nobody wants to sit and wait to have all of your information. And especially if you are an individual, let's say you are unconscious or whatever, you want to be able to receive the service quicker by having the information available at the doctor's or the nurse's fingertips, as opposed to having to wait for family members to come and say, hey, this is my son Robbie, he's allergic to penicillin, don't give him that medication. It means now you can receive care a lot quicker. So that is the really crux of the matter. You come to the hospital, we will have your information, we will build up your information, which allows the doctors, the nurses to do the things a lot faster. And I'm happy that we have our person from the hospital who can really explain a little bit better to the individuals as to how it's going to positively impact her department also, and also the other departments of government.
Jennifer Joseph James, JJJ, that's interesting, eh? JJJ, Triple J, yes. Health Management and Information Systems Technical Officer. So explain to us what all this means. What are we talking about? Why is this important? What is happening?
Well, again, thank you for being here. So a comprehensive approach to what Mr. Robbie said, as well as what I am about to say. So the Health Management Information System, it is truly a resilient system which would provide a number of things. It would provide compatibility. So when we come talking about other systems, that would be able to be integrated with the system. Again, like he would have stated, billing, right? We would allow billing. So for at the moment, the process is people would go to the hospital, do their registration, attend whatever ward unit, wherever they are to go, and find out what their bill is, and then walk back down to make payments. So this will now remove that additional back and forth. So automation in terms of billing. So you would pull up the patient's file and be able to see the service that is being rendered, or to bill that is now that would be provided, the cost that would be provided to the patient, which will allow, I guess, the patient to be able to pay their bill without going back and forth. Then you have patient or provider patient services. So we have real-time analysis, which is allow the doctors to perform quick and informed decisions when it comes to making decisions around their patient. This is crucial for patient care. We also have integration. So this will now be able to talk to providers at the healthcare centers. So the healthcare centers can now directly work with hospitals around Dominica. So, for example, if a patient were to be or were to be taken to the Dominica China Friendship Hospital, there's no need for them to wait until they arrive to start preparing paperwork. The doctors would now be able to log in and see that the incoming patient, the details, the information about that patient, and be able to start preparing whatever is necessary in order to treat that patient or to prepare treatment for that patient. So the system will initially start with the Dominica China Friendship Hospital in terms of our implementation, and then we will move to our other hospitals as well as the primary healthcare centers. We are well into our research and development, and so we are now preparing for customization, which is a crucial segment in the implementation process. The system is well on its way to being customized. I know many people are excited about it because it's now taking our health system from a manual process to an automated process, which is crucial in patient care, in delivery of medication or medical services. And thus far, we are doing extremely well.
Interesting. I'll come back to you, but let us go to Pascal as well, from the radiology department. Janice, Pascal, give us a typical example of what would happen at this department, in line, of course, with what we are doing now, making it more digitalized. Give us an example from the point of the appointment. What would happen? Give us a scenario.
Okay, so good morning once again to everyone. And I'm happy that you started off with that question because it puts into perspective the practical application and why it's necessary to have this digital transformation. So currently, persons who require appointments for whatever procedures, meaning x-rays, ultrasounds, CT scans, MRIs, and so forth, they would have to contact the department via telephone or walking in. And once you have that appointment, there are certain things based on the study that is to be done. You need preparation. So now you have to either go back to get whatever it is you need to prepare for the procedure. Then you come on the day of the procedure. Then you have to be sent to the cashier to sort out payment. Then you come back. We have to understand that persons are very busy. And not only are they very busy, sometimes they have limited time to access services. We book appointments and it's difficult at times to honor the actual appointment time because there's so many other things that have to be done before the patient actually comes in to the department to have the service provided. So it's very important for us at this stage. I think we're the department that's most excited, if I say so myself, to have this come on board because most persons would know in the past you would carry your large brown envelopes with your x-rays in there and you haven't been seeing those for a while. So radiology has actually been digital for quite some time now, but what we have not had is the infrastructure in place to support the digital processing of our images. And what I mean is that a patient who is seen at the healthcare facilities, the type, let's say the health centers in the out districts, they're referred for imaging, but then how do their doctors get access to those images? And so it creates almost a bottleneck in the system where we are able to provide the service, but it's not complete because the process is completed when the doctor can get access to the images and complete the diagnosis and treatment of the patient. So this digital transformation helps us to complete a process that has been started, a transformation that we started years ago, but now we're having the infrastructure in place to support it.
I like that, but just before you come in, Robbie, I was just thinking, imagine me walking in with my my x-ray, as we call it, so you have this long image and you have all your receipts, you maybe have something written for your appointments and all of that. That will no longer be. That's what you're telling me essentially.
That will no longer be.
Okay. Yes, Robert Tong.
So I want you to just close your eyes for a second,
I'm
right?
doing this.
It's important to close your eyes because sometimes when your eyes are open, you're distracted, right? So close your eyes. You want to make an appointment for an X-ray. So all you do, you'd go on the government's web. I'm even closing my eyes too. So you go on the hospital's website and you go to the appointment calendar and you say, I'd like to make an appointment for that day. It'll show you all the slots that are available. You'll select the current one, right? Once you select the current one, it will tell you, fine, we have booked you for that particular day. Like she said, all of your information will be on the system. And obviously, some doctor may have requested that information. So you can actually put in, I want that doctor to see that my information when it's prepared. Then something happens and you're supposed to come on a Wednesday, and something happens and they no longer can see you. You're going to drive all the way from,
Capuchin,
let's say from Capuchin
Pennville, yeah.
to Roseau, and then they tell you you're not available. Guess what? With this system, if there's a change, it will send you a notification, an SMS, a text message, or it'll send you an email to say, hey, your appointment has been cancelled or it has been transferred to the next day. So imagine the convenience of that happening, right? Or they might say, hey, one is earlier, that type of stuff. So information will be able to be pushed to the client, because the client will also have his application that they can use. If the client is not able to use it, they will also on the system put who is their next of kin, because all of us sometimes have let's say your grandmother, you are the next of kin, you handle her book and everything else. There'll be no longer any books, so that you will get that notification and say, hey, tell granny that her appointment is on that particular day. When the service is done, it means now that notification can be sent to the respective doctor or the respective department and say, hey, that information is ready. And again, you can see how much it's going to change the way that we provide services to our clients. The doctor no longer has to wait to bring a piece of paper or some type of document. They'll get a notification and they'll be advised of what has to happen.
Interesting. What I'm getting from this, Jennifer Joseph James, is like essentially every aspect of the health sector in Dominica is being digitalized.
Absolutely.
What is the response thus far? What are you hearing? What are the reviews you're getting from people that will ensure, of course, that we're on the right track?
Okay, so it has been amazing. People are waiting. They've been asking how long. So what we've been conducting is the SRS reviews, which are the gap reviews. Really, SRS stands for the Software Requirement Specification. And we've been meeting with individuals at the hospital and even a few on the ground to have discussions with them, not only for information gathering, but also when it comes to the customization of the health management information system. We need to understand exactly their process and what they're doing. And to be able to see that a manual process, to take it from manual to create a robust automated system, it is amazing. But to be able to share with the individuals what is going to take place and to show them demonstrations of what they're getting, they are excited. You may have one or two that, I at least have come in contact with, but the majority that I've interacted with is excited and is awaiting the new change, to the point where they're asking, how soon can we get this change?
Robiton, I'm thinking back to when you would have been on, of course you have been on several times already, but specifically when you were on talking about the digital hubs in various communities. And I'm thinking to myself that this was like a preparation for all of what we're doing right now. Okay. Because in various communities you have the centers and people are being invited, to come and learn, simple things, basic things.
Yeah, it's a strategic approach. So like, we've been here for quite some time. Part of the process was to go to every single doctor, every single nurse, every single person in the health sector. I remember I went to the to the amphitheater at the China French Hospital, where every day I spoke to about 100 staff. I think there are about 600 staff, right? Yeah. So 100 staff, just to explain and go through all of this system, because people have to understand. And I always say to people, you have to speak to them about 3 or 4 times. The first time you speak with them, their hands are like this. What is that? What Mr. Tong talking about? The second time, the hands have to go down. By the third time, they pick it up and they say, boy, that's going to make things a lot easier. I can see this happening and I can see this happening. And they begin to explain to you. So like Jennifer says, the staff are at the stage now where they're saying, hey, you guys are taking too long. We need to see this. Yes. So what Jennifer has basically just said a while ago is that just for people to understand, we've gone from the stage of talking to people, change management, putting it out, getting the terms and conditions, putting it out for people for vendors to tender on it, selecting a vendor, getting the people to come here, showing them what it's looking like and how it's being done already. So we're at that stage. So when she talk about the SRS, the staff members now are going on the system, seeing how it's working and saying, hey, we need a little tweak on here, change this, that's not going to work. So we're at the stage where we're way ahead, and hopefully that will be implemented very soon. So we are very close, and we just want persons to be patient, and that's why we're explaining to the public also that there is going to be a change, and there's going to be many benefits for them. So you come into casualty, instead of having to say who's your mother, who's your father, all of that types of stuff, and you have a serious pain, you can just give them your code, and they will pull up all of your information. And you don't have to go from one to the next. So everybody begins to see your information, and only those persons who have access will see the information. So if you're not supposed to have access to a file, you will not have access to it. And any changes to a file is recorded. And if anybody does something wrong, they will have the laws are also being changed so that there will be proper accountability for these things. To get into the system, you have to use a password, and also the users also a fingerprint to ensure that only the person who's using it is supposed to use it. We're also training them in terms of when you've used your computer, don't just leave your computer on and go to the next site, because it means someone can come on your computer and they can go and see what is your medical record. It'll then show that, hey, this person went into my system and used the thing, and the person who logged in is the person who's going to be responsible. So that's why we also look at the digital hubs, where we're training people in terms of digital literacy, how to use the computers and how to protect yourself. It's very important.
I'm thinking that there's a backup service for this as well in the event that something goes wrong.
So in Dominica, we have what we call 2 data centers. So all of the information is stored on 2 separate at 2 different data centers in different areas of Dominica. So if one data center goes down, the other one automatically is up and running. So the information is saved, and there'll also be information saved out of Dominica also.
All right. Pascal, let's go over again the key players in this system, the main users. What are those people?
Okay. Before I go there, I wanted to piggyback off of something that Mr. Tong was saying. Currently, the system is not just taking what we do manually and make it automated. And it's important for us to know that there are also improvements to the system, improvements in how it flows, at what point you get to different end users and so forth. So we're not just taking what we currently do and just make it an automated thing. And it's important for us to know that our systems will also be improved as this project is coming on board. And one more thing, we take it for granted that all of our clients, our patients, are coming in for service, walking and able to talk and explain everything to us. They are coming in the best state. We're dealing with persons who are unwell, they're not feeling good, and they may be affected in some way. They may not properly be able to give us information. So the person that has excruciating abdominal pain that comes in for A&E, you're not going to ask them this whole host of questions, because once you have the code, the patient's unique identifier, then it already pulls up every other thing that is going to be important. Because in the midst of that abdominal pain, you don't remember that you're allergic to a specific drug. And it's important because the doctor may be thinking this is the fastest available drug to treat whatever you're coming in with. So it's important for us to understand how beneficial this is going to be, and on so many levels. And as you were asking about the different end users and the different areas, at the hospital only, we have pharmacy, we have the lab, we have physiotherapy, we have a cardiology department, we have echocardiograms. Persons come into the hospital from outside the hospital to access a number of services. They do not have to be inpatients. Our inpatients are those who are on the various wards, get seeking medical care or getting medical attention. They come from outside. They come from their homes directly to the service areas. So it's important that even before they come, they are aware of what is the preparation that is required. I will go back to radiology because I always promote radiology everywhere I go. You have certain procedures, a CT scan with contrast, persons who have had MRIs with contrast, and there is preparation that is required, and you have to get preparation sometimes 2 days before. The client has to come to the hospital to get a date and then be told, oh, but we needed your blood results from your doctor to ensure that you qualify to have this procedure done. Then they have to go back to their doctor because they're coming from a private doctor's office. We give different scenarios because this is what happens on a daily basis. But now it's easy that once the client goes and they book in the appointment, they can also see what is required, the preparation for this particular procedure. So it makes it much more easy. I'm thinking of the person that coming from Tukari, and you have to tell them to go back and forth just to even get the appointment sorted out. They haven't even come in for the procedure as yet. Think of the grandmother who has to have their niece or nephew living with them, take a day off of work to facilitate accompanying them to the hospital to get investigations done. They could have sorted all of that at home and come in only on the day of the appointment so that they don't ask us for a paper to give the employer to say they were at the hospital for the whole day. And they had to get another one the following week because the first time it couldn't be done because the person was not properly prepared. So this is a game changer, really. It's really going to enhance the way that we offer services. Services are not only supposed to be available, but accessible.
Very true.
And this helps us to improve accessibility to our different services that are currently available at our different health facilities.
Okay, if you're just tuning in, welcome. Very important discussion that you should listen to. We can also take your calls a little later on the program. Of course, we end at 10:30. Very interesting topic that we are discussing as we digitalize the health sector in Dominica. A lot is happening. A lot has already happened, and of course the onus is on all of us, of course, to embrace this, to buy into this, to see this as necessary. I know for some of the older folks it may be difficult because, of course, they are accustomed with their books and all of that and all their papers, their receipts and everything like that. But they too have to fall in line. They may have children who can help, relatives who can help as well. But that is what we want, to reach the point where everybody uses this and sees this as necessary.
Yeah, so like you were saying, and even those who are not able to read, those who have mental challenges, it means you can assign a next of kin to them to help support them with the use of the information. Because right now, you have grandparents who just give the book to the child or caretaker who handles that stuff. So that has been taken into consideration. For matter of fact, that answer actually came up from one of the sessions that we had by asking those questions. And they said, it's going to be difficult, but this is how we think we should do it. So we had a lot of discussions with the different, all of the players, and they were able to give us a lot of answers to make the system better. So like Dr. Pascal said, it's not just repeating the exact same procedure. We've actually tried to make it even better than it was before. And there are many, many modules, and I think Jennifer may be able to touch on some of the modules because the hospital is huge, so she can touch on all the different modules that we would have for the system.
Okay, Jennifer, so you can... Yeah.
Okay, sure. So while we are speaking comprehensively about the health system, it does not only inculcate only patient files or what may be going on with a patient. It also has to do with tracking dietary, right? So if a patient is at the hospital and they are an inpatient, and the doctor prescribes that this is their
dietary
restrictions
based on their medical condition.
The kitchen area will have access into the system to be able to log on, like Mr. Tong said. Of course, everyone will have their unique identifier and their password, which they can enter the system, utilize the system to be able to see their current processes and be able to see what the doctor has prescribed in terms of the dietary for that patient. So it will no longer be an orderly or someone has to take the paper to the kitchen to be able to understand what needs to be prepared. The system will be able to track all of this. You also have the medical records, right? You have medical records, you have the orderlies, you have all of the systems within the healthcare that actually makes up our healthcare system. Everyone will have a tie into the system. Everyone's process is actually embedded within the system. It's captured, it's automated, and it's all seamlessly tied into one another to be able to tap from radiology to the wards, to medical records, to the lab, to blood bank. Every aspect of the system ties in, and this is what makes it a great aspect, because not only is it seamless, which means that it when it comes to interoperability, then data will continuously flow to ensure that the doctors as well as the patients have instant data based on what it is that they're looking for.
I'm also thinking, what if a doctor from outside of Dominica wants to consult on, on a patient's case, what is in place?
So that's one of the great things about having a system. It means that the doctors have full access to the system based on their level. It also means that you as the patient, you will have access to a certain set of information. So imagine you travel, I'm taking it from that standpoint, you travel to Guadeloupe or to Antigua, you fall sick, and the doctor wants to know about your history. It means you can give the doctor access to your file, right? You could send the doctor a PDF with your whole history, and the doctor can easily see all the different things that you have. The doctor can see who's your attending physician and the contact information and call that person back once you give them that permission. So it means that you wouldn't have to wait to call the doctor at the hospital in Dominica to ask them for your file and then to send it up. Certain aspects, you will have that basic information on your system already. So you can well imagine it just makes it allow you to receive that care a lot more easily and to have proper information for that doctor to make the right diagnosis.
It would be remiss of me not to ask how costly is this undertaking. Maybe not an exact figure, but obviously this would cost a lot. We know obviously as well that the cost of healthcare is exorbitant. So imagine us doing this, as a small island developing state. Let us look at
the project. The entire Caribbean Digital Transformation Project is a huge project. It incorporates digital identities. It incorporates upgrading our registry, document management, changing the laws, hospital management. It included giving out 8,000 devices to people, the innovation hubs, so many different things. So the project is $28 million US, and the hospital management system, because it's so important that our people are taken care of, is the largest portion of that project. It's actually $8 million US that is taken into consideration. Somebody might say, why is it so much? These systems are very expensive, but what is also very important is that for a system like that to work, you must have all of the equipment that is required. Every single individual must have the devices. So it means even the ladies, the nurses who go out on the field to go to your homes, or persons who are bedridden and stuff like that, they will have that information and putting that information. Also, every single person has to have their device. The doctors have to have their device. So imagine, nowadays you're ready to be discharged and you're sitting down there and you're waiting and you're hoping that the doctor is going to come. Now a doctor can get an alert to say, hey, this person is ready, review the file, click a button, and you could be technically discharged. So that's how easy it's going to make our system. Even some of the nurses, especially at the health centers, like I said, initially they were saying, okay, maybe, but when they realize it's going to make their work a lot easier, I think most of them have to write 6 times. The same thing about 6 times over. In their book, in the client's book, in the doctor's book, whatever book. Now, just imagine you write once and that goes through the entire system, and everybody will have access to it, especially the supervisors say, you mean I no longer have to write all of these reports because the system is being created in such a way some of the standard reports can be automatically generated by themselves and also by their superiors.
Mr. Tong spoke about the handwriting of our nurses, and our nurses have lovely handwritings. We can't always say the same for our doctors.
Right? I agree.
So
I was supposed to be a doctor, so I have horrible handwriting.
It takes care of that as well. There's no confusion there as to what was written. Nobody can really understand. And I want persons to understand that your information is secure. We know that we see the books in all of the plastic bags, and now they're in the shin bags. They're in the shin bags now. They got a little upgrade. And so all of these books, but then Hurricane Maria came.
Exactly.
How many books got wet? How much vital information that persons were holding on to for a number of years was lost in a couple of hours.
And even when they forget the same books on the bus or in a shop.
You will get the grannies upset, you know.
So these things happen.
So it happens. And so this allows us to have your information secure, where it's accessible to you, accessible to your care providers, but it's secure. And I want persons to know that not because it's on a computer or it's in the World Wide Web that some people think everybody will have access to it. No. only persons who need to have access will have access. And even in our various departments, everyone would not be able to see everything. There will be levels of authorization, and based on your authorization level, it's what you will be able to see.
So let me provide a
Sure.
synopsis in terms of accessibility. So everyone who will be able to access the system will be, so it will be considered role-based, right? Which means that a group of individuals, whether it's management and key stakeholders, will sit together and decide who should have access into the patient's file, who should have access into, be it dietitian, the wards, whatever it is that pertains to the patient or even to the administrative aspect of it. There are going to be key decisions to decide what access, who should have the access, and there will be an audit trail, as Mr. Tong would have also stated, that any time the system is accessed by anyone, that it automatically logs that information to inform individuals when audit is being done, what was done, who access it, and what time. Because I know one of the key questions that came up was will everyone be able to see my information? Because we're talking about health. And so we can help put their minds at ease to inform them, no, not everyone will have access. Key players who have been identified and given the access into that patient's file will be able to have that access.
And very importantly, one of the first things that we did was to bring in consultants to review all of the laws that would allow us to be digital. They've reviewed them, they've made amendments, they've also drafted new laws and regulations that is now with the AG's chamber for their final review and then taken to cabinet, and if those that have to go to parliament will go to parliament. Because again, people's information is very important. So you have an Audley, right, who wakes up in the morning, he comes to the hospital. The only information, when he logs into the system, the only information that he's going to see is that he has to move 5 people free to that ward to ward number 1 and free to ward number 2. That is the only information that he sees. He does not see any information. The person who's going to the person in the kitchen who's going to bring the food, all they're going to see is that we have five meals. I'm not a technical person. 5 meals for persons with pressure, 5 meals for persons with sugar, and 5 meals for regular individuals on these wards. So they will see that information and they will know to bring it to that particular bed. The bed will have the persons, everybody will have a band with a scan, so you can scan it and make sure that that food is going for the right person to reduce any issues. The same thing is going to also apply for medication to make sure the right people are getting the right medication to reduce any potential issues. I'm not saying that they are, I'm just saying it's just to reduce potential issues. So you only see what you have been given access to see by your supervisors.
So the patient information on the end of the bed, on this little chat, like that would be no more.
You will not see that, no. So no one can come and read that.
Yes, okay, very interesting. So we're talking about patient identification. That is one of the services, of course, that provides clinical diagnosis, lab results, prescriptions, and all of that.
Yes, so once you scan it, and based on your level of access, you will see,
okay,
a certain amount of information.
So what is happening even as we speak? Training continues. There's a lot more that we have to cover still. At what stage are we, though, in all of this?
You want me to answer that? So currently we're in the state of completing our gap study reviews. We've already completed about 37 gap studies, which are actually meeting with the individual departments and understanding their process flows and being able to take that information to be able to take it to development and customization. So we have a few more to go. Once we've done all 41 SRSs, which I would have stated the SRSs are the software requirement specifications, which is what's necessary for every application development team to be able to take what's currently being done and turn it into an automated process. So we have a few more to go. As soon as we're done with this, then we would have moved into the development and customization of the system. From there, then we would go into the testing, where many key stakeholders would have had a place at the table to be able to do some testing, understand what it is they would like to tweak, if not any, to move to the next stage. And then, of course, we would have moved into implementation, but we also have training that, of course, every key stakeholder will be able to be trained so they can now go back and provide information to their employees.
Interesting.
And one of the pieces, whilst we're training the staff, It will also be the awareness to the entire community.
I was about to ask
with
that.
the
How
health,
do we get people to buy into
together,
this
together with the health promotion unit so that they can
Okay,
see,
so
to
you'll have
better explain
consultations and things like that?
how it's going to work, what it's going to
Okay.
look like, hear all of their questions, and give them all the answers that they would need.
So we're saying this to the public as well, as we
Yeah,
said
definitely.
from the onset, that they have to embrace this.
Definitely,
Yes.
definitely.
Absolutely.
So we'll have town hall, like consultations, maybe town hall meetings and things like that.
That is correct. On all of the communities based on the districts of the health centers, if I remember correctly.
Yes.
So how many health centers we have? 42? 42, 43?
49.
49.
49
Yeah.
health
So we
centers,
have to
wow.
go around the whole of
Wow.
Dominica again just to ensure
That
that persons are aware and can understand what is coming.
Yes.
And I think one area that's for our department in particular, and I know the other departments across the hospitals and all the health centers, we do a lot of statistics every month. And statistics help us to make informed decisions. It helps us to see trends. It helps us to see where we are increasing, where we need to put more resources, where we need to make changes, where there are changes over time that have to review our processes and so forth. And so this helps us to get stats at a click of a button. Because presently we have to manually count every month to get the stats. So we count the number of x-rays that were done, the number of CTs, the number
Manually.
of MRIs by
Wow.
district, where the patients are coming from, what types of studies. And that helps us to know, okay, we need more staffing in this area.
True.
We need to improve access in this particular area. We need to increase the number of appointments. And so statistics are very important for any organization to be able to make decisions. So it's going to be very helpful for those who are tasked with the duties of preparing stats on a monthly basis. I know for sure they're excited for that click of a button stat.
And there's one other,
Sure.
as you mentioned, that there's another important aspect to that. Because we're collecting data at every single point, so it means that you fall down in Portsmouth, you go to the health center, they take care of you. They say, you need to go to the hospital in Portsmouth. By the time you get there, that information is already in the system. Then they say, something, we can't handle you there. You need to come, we need to refer you to Roseau. This system is so robust. You may even have to, it has the ability for you to even to skip, to potentially skip casualty and maybe even go straight to the ward because they have all of your information. But apart from me, I also love numbers, and what is really important too is that in terms of surveillance, it allows you to have real-time surveillance. So take for example, there's a new flu or a new cough or whatever that's happening. You will actually be able to see it's beginning to happen in this particular area, and you can see the clusters, and you can begin to take action even before, as opposed to waiting for it to kind of blow out of proportion before you can take action. So these are some of the important things that it'll allow the statistics persons like Dr. Ahmed and the others to do.
Might I also add, if you don't mind, it would be remiss of me not to. So it's funny that you mentioned Dr. Ahmed. So yesterday we had a discussion with him, and having the system will have the ability to provide reporting, not only on doing some data analytics for people like Dr. Ahmed, but also for the nurses, right, who have to create monthly reports. Then the system will actually be able to give a dump of the actual data that they're looking for, and that could be either in an Excel spreadsheet or a Word format, whatever it is. We would have customized the templates to be able to provide the reporting to exactly what it is that every department would be looking for. So that is an excellent tool. The other thing that I'd also like to mention is the engineering aspect of it. So the engineering team at the hospital will have the ability to track devices and equipments and be able to tell what's where, and if it's down, the labor cost for it, as to if it needs fixing or if something has gone bad. But it has the ability to do all of that. It's not only health, but everything that is tied to health that will be a part of the system.
So I say that the system helps to take care of the people who take care of the patients.
Very true.
That's it. I
Very
love
Say that
that.
again. Let me
The
get that
system
right.
will help to take
Take
care
care.
of the persons who take care of the patients.
Yes.
Yeah, so it's not just the patients who are going to benefit,
Right.
but all of the individuals. So just imagine you'd have to sit down, and I see sometimes these are huge, big green sheets that they have to tabulate that information. It means once the information is entered once, it's in the system. They're telling us right now we want this report, that report. The report has to have that type of information. And even external organizations also require information.
Right.
Once you have the information, you can actually create the templates for them and just push the information to them once approval is given.
Absolutely.
So now persons can spend more time to monitor the results and provide the best possible service to the patient care.
Yes.
So Dominica and the other OECS countries are doing this?
No, Dominica.
Only Dominica?
Based on the 4 countries, Dominica is the only one that has
Wow.
targeted that particular project. So that was what was more important. One of the more important projects for us is to ensure that we can provide the best possible health care, and at the same time making it easy for our healthcare providers.
I thought there was a blueprint in the OECS that we are following, but we are piloting this.
Well, each country in a sense determines for themselves what is more important,
okay.
and more pressing
What's more
at the time.
applicable to them. Okay, interesting. Okay, so someone is telling me via WhatsApp that they joined late and they would like a recap of exactly what we're talking about. Maybe we're not delve into so much, but at least just put it in a nutshell. What exactly is Dominica doing? What is happening?
So part of the bigger picture is to ensure that we are using digital technologies to our best abilities for our businesses, for government, and for our people. We provide a significant amount of training, again, to ensure that our people know how to use those systems. This particular project is the Health Management Information System, which will allow all of the hospital to have all of our patients' information so that we can provide service to our people a lot quicker. So if you have an issue and you're seen at the health center, automatically it means everyone who's on that system who has the ability and the rule to see the information will have that information. So if you go to the hospital, they know who you are, your blood type, your brother, your sister, all of these things, what issues that you've had, what medications that you've gone through, how it worked, and all that types of stuff. So again, it allows us to give you better care. I just mentioned something and I realized I missed out a piece that I should have said, but maybe if somebody else
Let me say something
chimes in,
real
I'll get it.
Right.
Sure.
So might I also add that it's also taken our manual process at our hospital and literally transform it into an automated process. So it makes things seamless, it makes things easier, quicker in terms of delivery to provide informed, better customer and better patient care.
And like we also said too, it will have an appointment system that will allow you to make appointments as opposed to have to call and not get answered and that types of stuff. And even after you've gotten the appointment, it'll be able to push important information to you to say, hey, you're going to do this particular test, make sure you don't eat at 12 o'clock. So technically, once you program that stuff into the system, it could send you a SMS message 12 hours before or 24 hours before to say, hey, stop eating.
Okay, interesting.
And if there's a cancellation, it can also send you a message to say it's cancelled and here's a new date.
Okay, all right. Let's see if someone wants to share with us. Hello.
Not to share, but to ask a question.
Okay, go ahead.
Okay, so clearly desirable and access becomes more available to all the entities, all the relevant entities. So given that, can you speak to how you maintain patient confidentiality under this new system, so to speak?
Patient's confidentiality, you mentioned, right?
Yes.
Correct.
Okay.
So what I would say is that every user who's going to use the system will have access based on their role.
Right.
And they will only be able to see what they're supposed to see. To log into the system, they would have to use their password and their fingerprint, so you know it is that particular individual who has gone into the system. Any change to the system will have a proper audit trail, so you'll know who has not only gone into the system, there'll also be a trail to tell you what changes have been made to the system and also what files you've been going into the you've been watching on the system. The laws of Dominica are being upgraded to ensure that persons who break the rules or breaks the law or shares information maliciously will be impacted based on the law, and those who also share information in error will also have some form of responsibility to take as a result of that. The system will be properly managed. In addition to that, it'll be on more than one server. So we have 2 data centers in the event that information goes bad. As part of our strategy also, we talked about the training. We actually have a lot of training being done right now for persons to come back in and begin to support those particular systems, because obviously it's going to be more computers, we're going to need more people. So we actually have a program where introduction basically to computers and stuff like that, where about 246 people have signed up. The intention is that if they do the first course, then they can do networking, they can do cybersecurity, and they can do other courses, again, to ensure that Dominica begins to have a cadre of people who can provide these services. We want our people to be able to provide these services on all these systems and out throughout our businesses, because it's not just us as the government, it also means our businesses have to begin to change, because if you don't change, you're going to begin to lose business. So take, for example, right now, if you only accept cash, more than likely I will pass your business straight because I want to use a debit card or I want to be able to pay for it online. So we have to ensure that all of our businesses and all of our services are very easy to access.
But might I also add that an individual will also be given a unique identifier, which will be their ID that will be used to log into the system. And so every unique identifier will be tracked within the system, and their access will be given based on their job responsibilities and their access that their management see that's necessary that they should have.
And one more thing, currently there are certain lab results for any patient that we would need to do certain radiology investigations, but we only have access to those. We don't have access to see every other blood test that the patient would have done. So it's not even far-fetched from what is being practiced now, but you can appreciate even further the digital aspect of it, because patients have physical files, and if that file falls in the wrong hand, persons can maliciously use the information. You can take pictures, you can share information that you're not supposed to share. But on this digital platform, once somebody tries to go into the system, you will know there'll be an alert to say somebody tried to access a file that they do not have the authority to or the clearance to access. So it helps us to give better security to patients' information.
Okay, so that's what it is clearer. So there will be an alert if patient confidentiality is compromised.
Absolutely.
Okay.
So it will be logged, it will be alert, the manager will be informed, and then, of course, action will be taken.
And devices have IP addresses, right?
Yes.
So you can see
Who's logged
which
in, where,
device
what.
where somebody tried to access the system.
And like I said, everyone using the system is also doing their fingerprint. So more than likely, another person cannot go on your system and use it unless they have your same fingerprint. So that's why we also said digital literacy, you have to be also aware. Systems will also shut down at a certain period of time. So in certain departments, it may shut down in 2 minutes. In certain departments, it may shut down in 5 minutes. In the operation room, it may stay on for a much longer period of time for them to have access. So all of these things are being taken into consideration. And as we speak with the individuals, they are the ones giving us all of that information. So we're not just creating a system, we're making sure we speak to every single individual in the different departments, and they provide us the guidance to make it better.
And Pascal, I know that the radiology department is very busy, obviously. But this system, the implementation of this system, creates exciting times for that department.
Very exciting times. As I said, we have moved on to digital processing of radiology studies for a while now. So this infrastructure helps us to better improve in how we provide the services. The staff is very excited. We've had numerous sessions and they're all ready and asking when.
Yeah, so there's something called interoperability, is to ensure that all of the systems are going to speak. So like Dr. Pascal said, they have a system that works very well. You have CMS, which is the Central Medical Store that have a system that works very well. Our system will be able to talk to all of these. So even down to pharmacy, as opposed to waiting for someone to give you a piece of paper to go down to the pharmacy.
Your
That information will be
system can cover
pushed to
this,
the pharmacist. That information will be on your phone. You just go there and pick it up. If it's
Lovely.
not available, the person in the pharmacy can now push it out to a private individual, and you can go and get it filled out there. But
Hassle-free, I love
obviously,
this.
that one you have to pay for.
I love this
And of
hassle free.
course
Let's
that
go
will
back
be
to the
done
tele.
safely, instantly, which is one of the key things. But of course, when it comes to safety, that's one of the key things with data protection.
And even down to patient management. It can help you. It can even help doctors in such a way. I'm giving you medication, and you're supposed to take it, right? And I'm hoping that you take it. But if I go on the system and I see you've never fulfilled your medication, then it means you're not taking the medication. Then it gives the doctor even more better information and insight to help and assist individuals.
Because it would show whether that prescription was filled.
Was filled. That is correct.
Oh,
Yes.
interesting.
But again, only the persons you give permission to
Yes,
see
yes,
that type
yes,
of
yeah.
information will have that type of access. So the orderly doesn't see that. The person in dietary does not see that. It's only the respective individuals.
Interesting.
This system will also allow government to track all of the expenses of the hospital to know exactly how to budget and move the country forward.
Let's take this final call. Hello.
So clearly, this is very dependent on what I would call a very extensive and resilient network infrastructure, connectivity, etc. Right. So my question here is: are we satisfied that our networks are resilient enough, have the redundancies, have the diversities, the power system, especially for when there is inclement times, so to speak? I don't want to say weather, I said times. How accessible will my medical records be? I'm coming from Lapland after a storm kind of thing, because I need urgent medical attention.
Okay, that's it. All right. So yeah, is the
So
system robust enough?
after Hurricane Maria, one of the first things that we did as part of the digital strategy is to ensure that you have a robust infrastructure. So all of the government systems are actually connected by a network, a line network, so a LAN network. So all of the health centers, police departments. So if there's no power, those systems still speak with each other, right? That's one part. In addition to that, the government ensured that we had the fiber up top, right? Then you also have some of the tier 1 sites will also have the satellite connectivity and also the microwave connectivity. So all of these things have been put into place. And if persons will remember, there was that big project that was launched with Digicel. That was the project to ensure, and they would also remember all the roads in Roseau being cut up and dug up. That was part and parcel. The first part of the project is to make sure that our infrastructure is on top. You'd also realize that the telecommunication companies, they too also have what we call I call them cows, the portable devices, so that in the event that the system goes down, you can have internet connectivity. And once you have internet connectivity, it means the staff can have access to the system. So there's multiple ways for them to connect back to the system and upload the information. So even the ladies who are, I don't want to say ladies, even the individuals who are going out in the field, they will have tablets with a SIM card so that the information can be populated and updated to the system immediately. If for some reason it's down, when they come back to the health center, it'll automatically upload into the system. So we have taken as much of the steps necessary to ensure that not just this system, but the government system is as robust as possible and has the necessary backup features to allow that in the event of something going wrong, we can still connect with each other.
And might I also add, one of the key strategies that I was involved in is ensuring that I attend or go to every primary healthcare center to ensure that connectivity is there, right? It's vital, because we need to ensure that the people within who is working within the health center have the appropriate connectivity. And for anything that, we may have seen that there was an issue, of course, that was documented and informed, so that information could be communicated to the right people to ensure that the service is being worked on or should be worked on. But all of the necessary, like Mr. Tong said, all of the necessary steps that were required to ensure that we have created a robust interoperability, seamless transition into the system using it, that has actually been done, and some of it is still ongoing.
Okay, very interesting. Wow, I'm looking at the time already. We have to come to the end of the discussion. Let's get closing remarks, though.
I thought you said 11:30.
No, yeah, I mean, we could go on, but obviously there are other programs. But let's get closing remarks as we end this discussion.
Sure.
Okay, so I would just like everyone to know that this is just another means of improving the services that we currently provide. It has taken into consideration the problem areas that we've seen thus far, the challenges that we've experienced, and all steps have been taken to ensure that when this comes on board, all of these are taken care of. So accessibility to service, secure transmission of your data, accessibility to the services we provide, not only to have them available to you, but giving you everything that you need. So when you get to the point of care, we don't have any reason to send you away or turn you back. The thing I dislike the most is to send a patient away. Having the intercommunication with the other departments, being able to send images to the health centers, to the persons in the outer districts without having to wonder how the doctor sent me for my x-ray, but how do they get the results? That is a major thing for us because it's a challenge we've been experiencing. So we're very excited for this to come on board. We're happy, and we know that the patients will be very much pleased when it finally happens. So now we're just going to be getting more questions as to how long and how much longer do they have to wait. So we are excited for the digital transformation in health. We're happy for the health management and information system, and we'll continue to make strides to improve the services that we offer to the clients at the hospital, not only the hospital, but all our health centers and other healthcare facilities.
Well said.
And might I also add to that, that while change is inevitable, we have to understand that our government has made a significant improvement in ensuring that they've raised their hand to make Dominica the first island to be able to pilot this program. And as we work to ensure that we deliver a seamless, automated process, we would certainly want to say to the individuals out there to work with us, to be optimistic, to be positive, because like I've always been told, change is not a one-man team, it is an actual team of many. And what we have to understand is if we look at the glass half full instead of half empty, we would have at least see the positive insights that this healthcare management information or health management information system is bringing to the people. And so as we work together, we hope to deliver an awesome system to our country, and not only our country, but to our people. Thank you.
Okay, I see we're getting more calls, but we really have to end. But before we get closing remarks from you, Robert Tong, let me just ask a question someone sent via WhatsApp. And the question is, will the authorities provide health ID cards to patients when registered, so it can be presented to the medical departments upon entry to the hospital to facilitate quicker response and treatment?
Yes.
100% correct. So every individual will be issued an ID, and the intention is to actually tie that ID to our digital ID for all residents in Dominica. So every resident in Dominica will have an ID, and the intention of that particular ID, once you give that number to the health center, they will have all of your information. And the intention also is that once you give that information, let's say to the bank too, then the bank will know where you're from, that types of information, and reduce the amount of information that you'd have to bring. When you present that information to the police department, again, they will have all of that information. So the digital ID will allow an individual to be identified and be able for them to pull up all of the information. And everyone who's going to be at the hospital will be issued a wristband. We're even considering even persons who are visiting, to issue them through that system a wristband, so you know who's supposed to be at the hospital, because the hospital is so much bigger right now. Security is also something that we have to take into consideration, and that is being also looked at.
Okay, well, here's where we come to the end of this. Certainly a major undertaking in Dominica for our health system to become more robust, more resilient. I'm hoping that at some other points we can continue the discussion on radio and maybe bring in some other players as well. as
Sure.
we look at
That
what
is,
is
that, as you can
happening.
see, that is the intention, is to bring in different players from the hospital in the different departments so they can explain to the individuals out there as to how it's going to impact them and also the staff in the hospital.
All right. So Dominica's aim is to fully digitalize medical services, and we are well on our way. We have done so much. I did not realize that all that has already happened.
How
And,
far? What percentage would you say?
Yes,
we're at,
great
Jennifer?
question.
About 25 to 30%.
And that's a lot,
well into it.
considering, you know.
Absolutely.
Yeah,
Yes.
considering the small states, you know, that's a lot that
Yes.
we have done. So let me thank you, because you all are very integral in all of this, and
Thank you.
this will just only, you know, improve what we already have. You know?
Definitely.
And this is needed, especially now when you look at what is happening. So as I said, we can look at other players coming on. Robert Tom, before we end, yes? You have
Yeah, my final thing is that in order for you to know, you have to listen. So I'm encouraging persons to visit our Facebook page, visit our website, so that you are notified, especially our Facebook page and our Instagram page, so that you can see the regular updates as to what's going on,
interesting.
and you can have that information. So if you're not knowledgeable, it means things are going to pass you by, and you're going to wonder what's going on. There's a lot going on, so please visit our sites, Caribbean Digital Transformation Project.
All right, so let me thank you, Jennifer Joseph James, Triple J, the Health Management and Information Systems Technical Officer, Dr. Janice Pascal, Radiologist, and Robert Tong, the Director of the Digital Economy. Good information, really good information. As I said from the onset, it's not a sexy topic. The calls are coming in now, because I guess people were listening and now they have the questions. But on another program, we can, of course, revisit some of the points that you made and look at going forward. Thank you so much.
Thank you
Thank
so
you very
much.
much.
All right, so that's where we come to the end of Talking Point for this morning. Very, very interesting discussion. And what I like about the social media platforms, having these programs on social media, is that for posterity. So if you did not hear it at the time,
Yeah, so this is actually recorded, so persons
yes,
can listen to it.